2 more. We still have 1 person out sick from last week. So, okay, how did everybody do with the teacup challenge? What was it?
Sleep.
Okay, did anybody get 1 night of 8 hours?
I did.
Okay. Is that normal?
No.
No. How did it feel when you woke up? Good. It's almost strange. You almost feel out of it because you slept so long. So you did not get, not 1 night. Do you not sleep well normally? No. That doesn't help. Okay, so this week's challenge is exercise. And you guys get to do this one for 2 weeks, okay? Since we won't be in person next week, your exercise challenge is going to be this week and next week. 15 minutes a day. You don't have to do extreme cardio or weightlifting. I just want you outside walking around. If you want to ride your bike, if you want to go for a walk, go run, whatever you want to do. Go swimming, 15 minutes straight, okay? A day. See if you can do it 15 minutes a day. I want you to come back in 2 weeks and tell me how you feel, okay? Okay, so let's go over here on the board. Today we're going to go over injections. We're actually going to sit at your desks and practice doing injections today. We're going to try to keep as much of it as we can right here at your desk so everybody can do it together so there isn't so much downtime. Then we're going to do EKGs. We're going to shoot to start EKGs at around 10:30 to 11. What we're going to do with that, I'm going to show you the machine. We're going to talk about where to place the leads, and then 2 at a time we'll go into the lab, and you will practice actually taking the gown off of the patient in the bed and placing the leads on, okay? So we'll go through that whole process on the dummies. Normally we do it either on one of us, you know, somebody would offer to do it, or you could try to do it on yourself, close it, and sit down and push the buttons, but you can't have everybody touching skin. So we'll practice on the dummies. Also, something we'll talk about later in the day is final project. I'm going to give you a rubric for that.
Yeah, that's what I did. Yeah, that's how I want to call them. So I was like, we're going to try to, you know, go through and answer them, and if I don't, I'm trying to go back. Yeah. Yeah, because I was trying to press the answer and it's like, and so we're like, okay.
Then you can't answer it. Well, then you could do is write the question down, write the answer quote, but notebook.
Yeah.
So Tues, what we were talking about was how did your teacup challenge go last week? Did you get more sleep? Did you focus on your sleep at all last week?
No.
No. Okay, well this week's challenge, new week, is exercise. So we're going to do this challenge for this week and all of next week since we're not going to be here in person. So 15 minutes a day, any sort of exercise you want. Okay. All right, so going over this again. Injections, we're going to practice today. EKGs, we're going to practice today. And then we're going to go over the chapter in between all that stuff. So it's kind of going to be mixed in. We're going to go over final projects towards the end of the class period today. So final projects, I kind of want to leave it up to you guys. What we did last semester and what we normally do is you get paired up with somebody that you don't know. The idea is that you're supposed to work on your communication skills. You're supposed to be able to work with somebody who you wouldn't necessarily pick to work with, okay? Like you would in any sort of work environment. You may not choose to work with that person, okay? Then you give a 5 to 10 minute presentation on any medical topic you want. So what happened last semester was we ended up giving them over Zoom. 2 people had to figure out how to work together and do it over Zoom. Now, if you guys want to work in a group, if you want to work with somebody you know, that's fine. We are literally completely already stressed enough in the middle of a pandemic. Kids doing virtual learning and working. I don't want to stress anybody out anymore, okay? The point of the normal group project is to teach you how to work with people you wouldn't necessarily choose. My point for the group project is for you to learn something and teach the class, okay? So you guys can think about it, you can talk about it. If you're more comfortable doing it on your own, 5 to 10 minute presentation. If you want to do it with one other person, still 5 to 10 minute presentation. You guys just split that time. So a visual is required. So that can be a PowerPoint, it can be a poster, and we'll probably end up doing them over Zoom. So something that you're able to put in front of the screen, okay? Now, if you choose to do it as a group, you don't have to be together in the same room. You can literally split your time on Zoom, okay? One of you can share the share screen. One can be talking, the other can be talking. You don't have to be together, okay? But I will give you that rubric later. Okay, so for next week, we are not coming in person at all. We will do Unit 1, which is chapters 1 and 2 in that learning path. Does anybody have any issues with Cengage that we need to work through? Everybody has figured out how to get to the learning path? You haven't had to do anything within the learning path yet. You've only had to access that full book, which is not part of the learning path. It's just part of that Cengage. So starting next week, you'll see how many activities there are for you to do. You're literally just going to click through each one. Part of those activities is also reading through the chapter. So it's going to give you a link, and you're going to start reading the chapter, and then it's going to have you answer a couple questions, and then bump you to the next section of the chapter. So unless you want to go back and reread the chapter, you don't need to click on that full book at all when we're doing completely virtual at home. Okay. The only reason I had you do the full book was these last few weeks, where I wanted you to just read only that information and not do the activities at home. Okay, so we're going to do a quick icebreaker. You have an index card on your desk. I want you to do, if you've heard of this before, raise your hand. 2 truths and a lie. So I want you to write 3 things down about yourself. 2 of them are true. 1 of them is a lie. You're gonna share them, and then we're gonna try to figure out which one is true and which one is not true. Okay? So 2 things that are true about yourself, 1 that is not.
Gosh, that is
Alright.
I cannot tell a lie. Let's put that one there. There's my lie. Eric, there. This is not too much in the way. And it's supposed to, it's good for a room twice the size. Yeah, $500, but it seems really well made. If anyone has questions, I can tell you about this. I did.
That's all I'm asking. Is everybody finished? Still thinking? one more minute. Is everybody set? Okay, who wants to go first? Go ahead.
Okay. What's in the mental health field for the very first 3 years? They put it in there. Which one is it?
Okay, two truths and a lie.
Yeah, I did that.
Okay, say it again. I didn't hear you. I'm sorry.
Work in the mental health field,
Okay.
very 33 years, they put it in their jail.
Okay, which one's the lie?
Going to jail.
Oh, your sister ratted you out. Is that the lie?
Yeah, I don't know.
Hey, you gotta work on your exercise though. Next 2 weeks.
I know, I gotta get now.
That teacher challenge.
That's all I'm
Next
doing.
2 weeks exercise. Do it.
Okay.
All right, you got that. Okay, Tanisha, why don't you go ahead?
I was telling you once, I grew up in North Carolina, I have 4 children.
All right, which one's the lie?
4 children.
No.
What was the first one?
I was telling you once.
And what was the second one?
I
North
grew up
Carolina,
in North Carolina.
she lied about North Carolina.
Yes.
Which one?
North Carolina.
Okay. Did you grow up in Virginia?
Yeah, I'm only here.
Okay, and that.
Okay, I was in the Army National Guard and Navy. I have 4 dogs and I'm from Canada.
Canada.
Canada. The lie, right?
Yeah. Okay, go ahead.
I have 5 siblings. I'm a mom of 2 children, and I'm the twin.
I'm a hard worker. I've never been scared. I'm always honest about how I feel.
Never been scared.
But,
I was born in America. I have bilateral dominance in my eyes. I cannot take it off.
I would say you can't fake love's a lie.
I like it.
what was
All right, what about the bilateral?
Yes.
You have that?
Yep.
Wait,
What
say
is
it again.
bilateral eye?
Both of my eyes are my dominant eyes.
Oh, wow. Interesting.
So it's the first one.
Yeah, I was born in Norway.
Or
You're
Mary.
born in Norway.
All right, Lucy.
Okay, you ready? All right. I have a 34-year-old son. I love to swim and I don't drink coffee.
You like this one?
Don't like
That's a
that.
lie. That's a lie.
I love my coffee, sorry. I have to have it every day, every night.
All right, so which one was the lie? Swimming?
Coffee, the coffee. Oh, I love to swim. I've made them to put a 40 yard this year. That's not good. We got some. Each one of my grandkids now, I have to all my foot.
That's awesome. Deborah?
So I have a twin brother. I've worked in medical all my life, and I've never cut my hair.
Never cut it. That's a lie. Everybody wants to go.
Never cut it.
You don't have twin brothers.
See what the medical people are like. She's too young.
And you're stupid.
Okay, Grace.
I love coffee. Summer is my favorite season. And I'm 21 years old.
She don't like coffee.
Yeah, I
never
think
seen
coffee.
it.
Is it coffee?
Summer.
your favorite season?
My favorite season is fall.
So we're going into your happy season.
Fall is, yes.
Okay, now you get to hear mine. I am an only child. I got on the school bus the first day of kindergarten at my husband's driveway. And I love IND procedures. Incision and debridement. So like when all the pus gets spurted out of the opening skin wounds.
I don't know.
Yeah. I have one brother, 7 years older than me, who's adopted. Yeah. But I did get on at my husband's driveway at kindergarten. The science seat in kindergarten was with my husband.
Oh.
The bus wouldn't come all the way back to our house because it was a gravel road. He was on the paved road. Yeah. Okay, let's get started. Okay, first thing we're gonna do. Good morning, Cora.
Good morning. Lindsay and I are communicating, so
1 second, guys.
Do you have the code for my school?
I cannot, it will not, I have to call the school in a few minutes.
Maya.
Okay, guys, we're gonna go ahead and get started. So, let's talk about injections. First thing we're gonna do today is practice all the different types of injections. One thing when you go on break, grab your skills kit. You don't have to do it right now. Okay, so let's talk about. Does anybody know what the word parenteral or parenteral? Okay, let's write this word down wherever you want to write it on your index cards in your notebook. Parenteral. Yeah, parenteral. So this means injecting the medication through the skin. So it's either going directly into the skin or into a vein or artery. You're going to do this a lot in an office environment. This is where you're going to see, yes, Parenteral. Injecting medication through the skin or into a vein or artery. Okay? So, the thing to know about these kinds of injections, they're very costly. Okay? They're costly to the provider, they're costly to produce. These are not something that you want to make an error with, either drawing up the wrong mountain, having to discard it, or dropping the bottle before wasting it, because a lot of these things that you're given are like an immunization, and they're extremely costly. Other things that have nothing to do with money is safety. If you are taking a needle and putting it into somebody's body in any way, there is definitely an increased risk of infection. Okay? This is not like putting a blood pressure cuff on and squeezing their arm. You are taking a needle, which they're trusting you is clean and safe, and injecting them in the appropriate way, making sure that you're not in the wrong spot, and administering medication they're supposed to get. So, anytime you're administering anything to a patient, check patient, right patient, check their date of birth, make sure you have the right person, and then when you are going to draw up any sort of immunization, any sort of medication, I want you to check that vial, and I want you to look on the side of the vial at the lot and the expiration. Make sure that that bottle is not expired. Make sure you're documenting that lot. Because think about it, if they have any sort of reaction, you need to have that information. Anytime you give any sort of injection, you have to document lot and expiration in the patient's chart. You also have to document location, so where you gave that immunization, medication, whatever it might be. So check the patient, make sure you have the correct person, check their date of birth. Also, always double check the order. Even if a doctor passes the night and says, hey, I need you to go get the 3-month shot. Look in that computer or look on what they wrote and make sure that you know exactly what they need. Okay? This is not the time to get assumptions that 3-month-old is going to get what the 3-month-old that just came 10 minutes ago got. Okay? Just kind of double check and do the right thing. Because I will tell you, it does happen. We kind of happen in our office where somebody would go in, a medical system would go into the room and think they gave the right medications or the right recommendations, and they come out and say, I didn't do the right thing. How do you handle that situation? First of all, you should be double checking, triple checking so that it doesn't happen. But let's be honest, sometimes errors do happen. We are not God, we are not perfect, okay? So errors can happen. If it happens, first thing you do, you talk to your supervisor, you talk to the provider, and you do not hide it. Do not hide it, period. Because that person could have an allergy to that medication, they could have already received the medication. Is that patient's right and the parent's right, their child, to know that there was an error made. Not to say that you give that medication and you say, oh my gosh, I did the wrong thing, I'm so sorry. Go say to your supervisor, it needs to be handled, okay? That's not something to brush under the rug. You will get in more trouble if you try to hide an error than if you communicate with your supervisors, okay? Okay, so let's talk about, we talked about the cost of it, we also talked about the risk. Risk to the patient is usually risk of infection, but there's also a risk to you if you're giving any sort of injection. There's a risk that you could get stuck, okay? So this is a situation where you need to be very cautious of what you're doing. All right, let's talk about the different types of injections.
That's what mine did.
Okay, first one, intradermal. intradermal, intradermal. So this is going to be a very, very shallow angle, okay? Let me go ahead and give you guys this now so we can move through it. So intradermal, very shallow angle. This is when you're doing something like a PT where you're checking those places that you are going for job deployment require you to have a PT. Okay? So look at this picture and find intradermal. This was the picture that was in your chapter. So when you read the chapter, I've already seen it. So look at intradermal. Look at the angle. 10 to 15 degree angle. That is literally almost flush with the skin. Okay? Look in your skills kit for a minute. And see if you can find just a range that looks like this. This is not exactly what we're talking about. This is very, very similar. And I want you to see how small the needle is. What you have in there is an insulin syringe. So intradermal is going right under the derm, okay? Going just barely into the skin. Most common place is right in here on the forearm. And sometimes if it's TB, like a TPD or tuberculosis screening, would be right in here on the forearm. Other place you can opt into the intradermal is on the back. If somebody's having like skin allergy tests, okay?
Yeah, I can't come out. They left it in there. It works fine out here. It
All
works
the
good.
back, okay?
Brown is not
All right,
working.
next thing, subcutaneous.
Nobody's.
Picture. What kind of angle is it?
That's my phone.
And I'm not even connected to the Wi-Fi here.
We're going to talk about subcutaneous.
People are already complaining.
Inch and inch. So somewhere where you get inch and
Working.
inch. Subcutaneous is going into the fat. So, common place. Back of the arm, in the belly, in the side.
But the first day they cannot
Inch and inch. That is going into the
Miss
cutaneous layer.
or
Just below the cutaneous layer.
wait.
Okay?
Mom said the first
What
one.
kind of medication?
They already said it in the newsletter because they're expecting to have issues, and a lot of parents are already complaining.
Losinox, if you guys have heard of that, it's something that people will get, especially if they're in a hospital or a long-term setting to prevent blood clots. Okay, all have reasons.
How to get any of my sick.
Yeah, we're using it.
Okay, next one. So we've got
I'll bring it here, please.
Intramuscular, what angle? Straight down. This is the one you're gonna have a longer needle and almost okay? So with intramuscular injections, you can actually get
You've done great. It'll be all right.
amount of a medication. So these are the situations we're gonna see like a child who has had repeated stress and they now need to have an intramuscular injection of antibiotics because the oral antibiotic does not help. Larger dose medication, usually stronger, more painful, okay? All right, so let's talk about the injection. So part of this, with the different types of injections, is you're going to have different lengths of the needles and different gauges. The length is how long the needle is. The gauge is how open it is. So if you're looking down into the tip of the needle, the size of the gauge, okay? So most important thing to know, there's a correct size. Depending on your office, they're going to have certain size needles for certain types of injections, okay? Always ask your supervisor if you're unsure of which one to use. Most places will literally have a cheat sheet. If you open the cabinet drawer, like where you're drawing some medications, and it'll say, subcutaneous injection, this size needle.
A friend of mine says school is having issues over here. No one can get access because they are having internet issues.
General idea. So, this is considered normal adult size. They're not perfect. And just gives you an idea. So let's look at that influencer review again. And look at the tip of it.
What's that?
Piece of food.
We're looking at something that's around 25 to 27 gauge. So it is really tiny. Can you see how tiny that opening is in your syringe? Yeah, right. You can open it up. Go ahead and open it up. So this is a good time to talk about this too. In a normal healthcare setting, we're never going to recap needles. For our purposes, with practicing, we are going to recap. You have to be extremely cautious recapping. Recapping is never okay in a healthcare setting, except under certain circumstances, like if you have to use a needle, like a threaded. I'll explain to you later. We go to an office, do not recap. Okay? Only here are we going to practice. So let's practice now, because I want you to see the tip of it.
I should be in science.
So go ahead and grab the orange, pull it straight off, and look at the size of this needle. You're going to go ahead and pull out your kid, so you can see with us. So, teeny tiny, right? This is considered an influence syringe here, okay? Yeah, go ahead, I'm sorry. This is an influence syringe. This is about the size of a PPD, what you would do for a tuberculous tube, but for intradermal. It's going to be just about the same exact size. Okay? This, wait till they get back. That's nice. Yeah. Makes it a lot more convenient than having to make syringes. Dial it up. Yeah.
She only likes to, she did rebellious, she had a place there to do it. And her arms, she like did so much there, it's like, people, yeah.
Okay, so. Make sure you both have them. Sorry, guys. You have a good day. You kind of. Okay, just go ahead and look at it. Once you look at it, I'm going to show you how I want you to recap, okay? You're going to put the cap down on your table, and you are going to do that, okay? I'm going to just take the needle into the cap, get it completely on, okay? And then once it's completely covered, then you can push the cap down, okay? Do not ever recap intradermal. So we're going to pretend these are our intradermal needles, even though if you look at it, go ahead and look here on it. What do you see? What is it measured by? What's all our spots? Units. So units is insulin, okay? This is for insulin only. You do not give a PPD, a tuberculin screening. You do not do that with this syringe. It needs to have 0.1, 0.2, 0.3, okay? So this is not the correct syringe for giving a PPD. For practicing purposes, you see the size of the needle though, okay? So, intradermal, tuberculin or allergy testing. This is all right here on the sheet in front of you. So you don't have to write anything down. So, what you're trying to do with this is create a wheel, W-H-E-A-L, a wheel, right there on your paper. It's a lump, okay? When you are placing the PPD, you want to see that lump form, okay? That's important because that's what's going to be read later. If you don't create a lump, it's a little bit of an issue. You talk to providers, see if they want you to place it again. The idea is that's supposed to be visible before they leave the office, okay? And we'll go over how to do that in a little bit. So, the 0.1 milliliters is what is effective for a PPD. That's why you cannot use this type of syringe. You need to see that it says 0.1. Okay, patient has to return within a certain amount of time. That is your job to educate the patient. They need to come back in 48 to 72 hours to have it read. If they waited beyond the 72 hours, guess what? Yep, it has to be done again. Now, if you get a positive result, and we'll look at a little paper later, we're going to show you how to read a positive result. These are the people who will often be sent for chest x-ray. If they get a positive, doesn't mean that they have it. It means they could have had it previously, or it could mean that they're just sensitive to that tuberculin going into their skin. They'll often be sent for chest x-ray. We will have some patients that don't even have a PPD plate. They just have to automatically go for chest x-ray because of previous positive. Okay. All right, so what you're looking for to document with an intradermal, if you're checking that PPD, they want to know what is the end duration. So 0 millimeters is a good result. That's what you want. You want there to be nothing there. You want that person to come back. You can't even tell where you placed the PPD. Okay, that would be a 0 millimeter end duration. And that would be negative. Okay, let's talk about subcutaneous. So, what was that angle for subcutaneous? Yeah. All right, so same thing. You're going to have a very similar gauge to what you saw right here on that 25 to 27 gauge. You see how tiny this needle is. It's not very long. Okay. So small doses of medication. These are things like insulin. You're giving just a very tiny amount. So locations, like I said before, you pinch an inch. Where? Upper outer arm, right in here. So see, you can pinch an inch here. So somewhere where you have fatty tissue. Okay. And are you going straight into the fatty tissue? 45-degree angle, either up or down. Okay. All right. And then the last one, intramuscular. So 90-degree angle, straight up and down. And then go ahead and find your syringe that you have in there. You don't need to open it yet. You should have a syringe in there with a long needle attached to it already.
We can have a class one throwing something.
It should be a 5-millimeter syringe. Did they see it in there?
No, I'm not even in. So my first
Okay. Is there a needle separate?
I log in, just like you have some. I don't
Not the filter straw. Okay, for a separate one.
I'm just getting my ready.
You're stuck too?
And me and I don't have any classes together, so opportunity.
Okay, so this one right here. I don't have any step on it. You need to go to that. I thought we had a needle attached.
But my mom has a meeting with my pillow, so
Don't open anything right now. I just want you to look at them, okay?
one of my classes are like, no, I was like 6 o'clock in the morning. And they kept telling me, they were like, call, join the call. I tried, but it was working. Who said that?
I just want you to look at the length
My
of the
mom.
video.
I said,
It's about typical for an intramuscular injection. See how long that needle is? So, it's 10 meters on the site of where the muscle is.
I know, well,
Where you're giving the injection. This does not mean that you should put this entire needle into a very thin adult cell. Okay? That is not appropriate. You don't have to change your patient's muscle as they are. If you have somebody who is very frail and they're very thin, you don't want to put that needle all the way into the point where you hit that white part there. Because you're going to hit the growth. Not too far. Okay? The idea is it's going into the muscle, but it does not need to cover the entire needle length. Okay? Now, when you're giving something like an injection, an intramuscular injection, and they're not, that's the time that you can go deeper in. Okay? Alright, so let's look at the syringe. Pick up only the syringe. You can go ahead and open your syringe up. Alright, what do you notice about it? What is it in measurements by? Milliliters. Okay. What does yours go up to? 3 or 5? 6. Okay. Typically it's 3. A lot of ones do not. Mine appears 5. What I want you to notice about your syringe is when you're drawing up a medication, go ahead and pull the plunger down. Do you see, not where it looks like a triangle at the tip, but the first black line. Look at your first black line. I want you to pull it to the 3 milliliter mark.
this is not worth it.
So if you are getting order to draw their medication and 3 milliliters of that medication, you want that black line right on the string. Okay? Not the lower part of the plunger, the top part of the plunger that is a straight line. Mine looks like a piece, like a triangle, not the tip of the triangle, right where that first top line. Okay? Now, other things to think about. Can you type on that?
Oh my God. I'm done. This is fucking shh. Like, if I'm doing it about if we just missed 1 day of school, it's the first day. Anyway. No, that's not
Okay, other thing to think about. When you were drawing up their medication, you want it to be to this line. So they're being bubbles. Does everybody know how to get bubbles out? It's not really right now. Okay. Hold it tight. And you can flick it. Okay? You flick it, you will see the bubbles pop all the way to the top. And then you want to just gently push those bubbles out, okay? If you push to the point where you've lost medication, there's objective. You're going to have to draw out more, okay? So that would mean they give me the arm again. We're going to go through all this later. But
Follow the time.
let's talk about first second too. I don't want to tell you. Drawing up a medication from a vial. You are going to use a different needle than what you're going to use on the patient. Even if it's a single vial, I still want you to touch the needle. Any reason why? Anybody think the reason why?
To the bottom.
Right, so. Always touch the needle. 1, because the bottle will be contaminated. 2, it's going to be dull, so it's not going to go in as easily. You already punctured something, but the needle is not going to be as sharp as it was. So, always touch the needle. How to touch the needle? If it is cast, safely cast, this would go off, okay? This would go where?
What we have to
In the jar. Do not set it on the counter, do not put it in the door, it goes directly in the jar, okay?
I'm not so bad at that.
Okay, so we're going to go ahead and talk about drawing from, did you guys see in your chapter, drawing from an ampule, so like a glass container, drawing of medication? Did you guys see that in the chapter? We have one in here. we're just gonna talk about it. That's not one that I wanted you to practice because it's not very common for you to see it. Does anybody see glass angels where they work now? No. Okay, we'll just talk about it. So, if you have a filter needle in there, go ahead and pull that out of your skill kit. Filter needle. It's long, it looks like it has a plastic sheet over it. Check and see. Is it okay? Look on the back of it. Does it say filter needle?
Filter straw.
Filter straw. Okay. We're not closing this up, I just want you to look at it. So, we're going to pretend that we have a glass container that you need to drop the medication from. The idea behind this is that it is glass. You need to be careful because one, you could get cut, and two, you don't want to get any glass into the liquid. Okay? So, you have your handle, your little glass.
I tried. I can't get through. I will here shortly.
Obviously, flip on.
I know his mom got through, so
Take
how
alcohol swab, alcohol prep pad, and
They've had a lot.
wipe around the entire area where
I will get through.
clean it off, you can sort of
Mom, because I need to put
then you're gonna take gauze. You would hold the glass angel.
Call the
put
school.
gauze over
I
the
can't
neck.
call it
So
on mine, or get the other phone and call it.
Down into like the skin of your neck. Hold the gauze there. You want to push it away from you.
Look at it. Look it up
It's very
again.
easy to break. It's not thick glass. The idea here is to break it away from you. Okay, always push it away. Then to draw the medication, you're going to use that filter needle or that filter straw to draw the medication because that is supposed to filter out any sort of glass pieces or particles that put upon it to liquid. Okay, once you've drawn up the medication, you need to recap. That's why needles aren't used very often anymore because you would have to recap it to get rid of that filter needle. Okay, because you cannot administer an injection with a filter needle on it. That was just to get the glass out. So, recap, which you're not supposed to do, discard that needle into the shark. That way, you would go ahead and fund whichever size needle to administer the medication. Okay, and that would depend on which route you're giving it, subcutaneous, intramuscular. Okay, that's all I want you to know about that. Most places do not use angels anymore.
Thank you for calling Middle School.
The risk of the patient having glass in their body, very, very uncommon. Some old school places will.
I
don't
told
expect
you
you
all
to do
this.
very much that anymore. Okay. All right, so let's look at. Hang tight for a second. All right, let's look at 53.2. If anybody has their procedure list. So, if you have this with you, we're going to go literally step by step. Does everybody have their procedure list? No, that's okay. All right, we're just going to walk through step by step. If you have them, great. If you don't, that's okay. So, this 53.2, preparing medication from a multiply vial or a single dose vial. Okay. What do you think we should do first before starting any drawing up? All right, hand hygiene. Next thing. Gloves. Okay, so wash hands, apply gloves. Compare the vial of medication to the medication order and clean the top of the vial with an alcohol prep pad. So, first thing you're going to do, what I would suggest you before you ever wash your hands or put your gloves on, is check the order. Check the order, make sure that everything was correct. Get that vial out, okay? Have everything ready, then go wash your hands, put your gloves on. 53.2. You're still looking. That's okay. We can try more if you need it. It's not urgent right now. We're just gonna talk through it. Some people like to look at it as we talk over. Okay, next thing you're gonna do, let's say this is a single dose vial. So this, all of this medication in here is what your patient needs. That would be a single dose, okay? Those single dose vials will come with a little cap on the top that you literally snap the cap right off. You can take your thumb and click it off, okay? Even if it's capped, you always take an alcohol prep and clean it. Because you don't know if your thumb raised it and your thumb just touched the mouth, your thumb just touched the drawer. Always clean it, okay? Right in the middle, circles, friction, okay? 5 seconds is good, 10 seconds is great. Clean it up, let it dry. Before you try to insert the needle, let it dry, okay? All right, what does number 2 say? Does anybody have a procedure list? Okay, that's okay. Number 2, attach safety needle to the syringe, okay? So this is assuming that these two things are separated, all right? So, we're going to attach this to get ready to drop the medication. Got my gloves on, already washed my hands, put the gloves on, clean the vial, this is attached. Okay, number 3, insert the needle into the vial stopper. Invert the vial and needle and syringe unit. So, I'm going to show you a little trick. Let's say this is 3 milliliters inside of this container. Pull your stopper down to 3. Okay, take the cap off. Put it over here, sorry. You're going to put it directly in. See how it's already putting pressure in it? Get up and all the way up above 5. This is a vacuum sealed container, okay? So chances are it's got more than 3 milliliters in here. Watch it. You see what happens? Yeah, but look, can you see? Is it full of liquid? No. You know why?
Need it better into it.
No. Look where my needle tip is. You see? Half the liquid. The needle tip went half the liquid. So, guess what? You're going to get a whole lot of air because it's not in the liquid. So, I just did a no-no accidentally, but now you can see it. Okay? Pull it down just a little bit. You want your needle to stay below the liquid, okay? So let's say you want 3 milliliters. You're going to get to the 3 mark. And then you flip it back over. These are extremely vacuum sealed because I filled them yesterday. Normally, it wouldn't give you all this pressure. And then you're going to put it back down before you pull it out, okay? So you put it all back down on the table. Pull it out. You can see that pressure. So let's look at this. You can find my cap. All right, so it's capped. Push it up the plunger. So look, I'm right at 2. There's a little bubble. I'm going to flick it out. Now I'm above 2. So, if I need 3 milliliters, what has to happen? I start back over. Should I use this needle again? Yeah. No. Should I put it in the top again? Yeah. All right, so, you got to be careful when you're drawing it up. Making sure that you have it right now. This is just for practice. This is not a normal vacuum container. You are going to have a lot of pressure in this. Okay. As normal as you could possibly get it where you go. All right, so what's the next step? Inject the air. That air that I drew up, you push it in. You want to push it up into the air pocket up here because it's going to be easier to draw the medication down below. Keep that needle down below the liquid. Draw it right in the medication. The whole thing down to the table to pull it up. Okay. At this point, you would have to recap it. Discard that one. You're ready to give it to the patient. You're going to discard the one you drew it up with. Switch the needle to the correct size you're going to give to the patient. Now, this is not a time to leave anything on a counter in an office. Okay. Some places will do like flu shot clinics where they will draw a lot of syringes. and then they will put them in the refrigerator. Everything needs to be labeled. If there's a sticker, great. If you have to use like paper tape and label it, great. What I suggest is don't draw it up until right before you need it. You do not want to give the wrong thing to the wrong patient, okay? If you draw it up, you give it. If you're watching somebody else to help them practice, they need to draw it up, they need to give it, okay? You're responsible for your own actions, they're responsible for their own actions. You draw it up, you give it. You draw it up, don't leave it on the counter, okay? It is your responsibility, you need to see that through.
In cups, some alcohol cups, don't give it.
Right.
Because it's needed for the dinner.
Right. It's your responsibility to give what you've drawn up. All right, so that's it for 53.2. The only difference here is these large vials like this are usually considered multi-dose. So some vaccines, like the pneumococcal vaccine that you give to kids, it would come in like 15 milliliters of the pneumococcal vaccine. Well, each child doesn't need 15 milliliters of that vaccine. They need a very small amount, which will be documented at your office. You'll know how much to draw up. So in doing that, you're going to draw up, let's say they need 2 milliliters. You're going to draw that up into the vial, and that's it. That will go back into the fridge. But these are extremely cautious about cleaning the top, even more so than the single use, because you want to know how many hands have touched this thing, and many doses that are left in here, okay? So always wash. Take away points from drawing anything up. Wash your hands, put your gloves on, have all your supplies in front of you. Clean the top. Air into the syringe. That's how much you're going to draw up into the syringe. Okay. Insert it. Push the air up here. Pull the needle down below. Draw up the certain milliliters that you need. Put it back down before you pull the needle out, okay? The idea here is that you don't want to fumble with your hand, pull it out, have it squirting everywhere, get the medication on you, and then accidentally get sick because you realize the medication is squirting, okay? So, put it back down the table, pull it out, recap it, scoop to cap it, discard the one that you drew it up with, okay? Alright, so I want you guys to go ahead and practice this right now. So go ahead and get your needle attached to your syringe. Yeah, the regular needle. I'll look to make sure you have the right one before you open it. Fine. I'm sorry, do you have another one? So it should look right like this, okay? The dark gray one. This does not have to take too long on it, okay? Those are the brown ones. Alright, so I want you to have in front of you, kind of clear your area so you're not still like clutter. And I want it in front of you. Yes. Perfect, yes. Alright, so I'm going to give you an alcohol press. Everybody good on the parts of the part that you get with it? Yep. So, a good way to practice opening these things too. Most needles, you can actually pop it out. If you hold the paper like this, it will actually pop right out of there. If not, the other way, just like you guys did, okay? Does everybody have an alcohol press glove? Alright, if you have your gloves in your bucket, if you want to put those gloves on, you're going to pretend that you already washed your hands. Put it in your glove. 2 milliliters. We're going to say this is a flu vaccine, okay? So, wash your hands, gloves are on. You have all your equipment in front of you. What should you do first? Wipe the top. Open up that alcohol press on, go ahead and wipe that top. Vigorously, okay? Check. Yes, of course. Every single time. Yes, every single time you get an order to do a vaccine, to do any sort of medication, you're going to look at that lot and expiration before you ever go on a patient's screen, okay? And this is a good time to do too. You're rubbing friction, clean that top, turn the bottle a little bit, look at that lot and expiration. Always double check the medication name too. Because sometimes the doctor will give you the trade name. So let's give an example. Advil is a trade name. They may know Advil is. Ibuprofen. That's right. So if they ever say, well, give them an Astra. What's an Astra? The pneumococcal vaccine. Always double check, okay? You're going to have both of those names on the vial. So make sure. Any question, if you're unsure of something, don't draw it up and give it. Consider it 100% confident. Have a question, just ask somebody. In any setting you're in, somebody would rather you ask a question than make an error, okay? All right, so you clean the top. Let's say you're getting 2 milliliters. What should you do next? Grab your syringe, draw out that air. It's 2 milliliters. Okay, don't freak out like that, though. That's okay. No, that's a good example. You can pull the cap off, put the cap down, and scoop it up, okay? I just don't want you to get close. All right, so draw out to 2 milliliters. Once you find the 2, go ahead and poke it directly in that vial. And push that air in. Push air in where it's only air, not in the water. Alright, now then keep the needle in. Once you push the air in, pull the vial and invert it. Flip it over. Yes? Go ahead and draw only 2 milliliters. This is a good time to practice making sure your needle is in the vial. Once you've gotten to 2 milliliters and you're happy with the way that it looks, if you get a bunch of air in it, know that you've pushed your needle above the point of liquid, okay? Pull your needle out just a tiny bit. Get your 2 milliliter mark. Once you're happy with how it looks in your syringe, flip it back over, put the bottle down on the table. If you're down below the liquid line, you should not have too much air in it, okay? That's always possible. If 1 or 2 bubbles is normal, but if you have what looks like a whole milliliter of air, check it. Well, just, and you can see where my needle is, play it above the liquid. So, push the air back in, and pull your needle out. Pull it pretty much just slightly, and get below the liquid. This is good to practice too, easily in the syringe. How are you going to hold the syringe? How are you holding the barrel? How are you holding the plunger? Okay, so once you've gotten to 2, flip the vial back over, set it down, pull it out. Okay, so go ahead and recap now. Put your cap down flat and scoop it up. Okay? Do not touch the needle, don't get your hand in the needle. There you go. Once it's completely on, then you can snap it in place. And I would suggest pulling it on the side, okay? So, what does that mean? You fish for it, you scoop it. Once it's on, push it down here, okay? Don't even stick your finger up here to tap it down. Pull it down right here. That prevents again you from getting it, okay? So, do we have any bubbles in it? Look at it, flick it if you need to.
Minutes.
Very, very, very gently get the bubbles out. So that means just gently push. Let's go ahead and check it. Be careful pulling it like that. Pull it, keep pulling the needle off. Whether it's drop something up or do an injection, try grab it up here at the tip, okay? Don't hold down here, because there's a chance that you could actually put it off. And then what? Now you contaminated this, and you have to discard this whole thing and start over, okay? Alright, so if it works out, I want you to put it back in. Take the cap off, so I'll let it go back in. Okay, once you put all the liquid back in, I want you to take it out. And I want you to recap that deal. Look at that one. And now I want you to try it about 4 milliliters. I want you to go through the whole process on your own and how you feel it. So, you can put your gloves on, go through all that in your head. Check in the lock expiration, leave it on top. Yes, 4. Once you've gotten to 4, take it out. Recap it and check for bubbles, and I want to see that you drawn it before. Yeah, there's a lot of pressure in the line. Okay, once you got the 4, we can use. Right? When you're drawing out to the 4 milliliters, the point of the 4, that left point of your 4 is where that 4 line is, okay? Yes. Yeah. Go ahead and recap it before you get it. You don't pull it. Get it really. Yep. And then here. along their line, like my fringe is a little more obvious. Which they guys, you see this fringe is a little more obvious than the forehead. The fore mark comes up more than the other mark. Just be careful about holding your hands because there's pressure and pull back quickly. You okay? Try to hold towards the top of the pile. No, that's it. Yes, perfect. Good job. All right, pick it up. No, that's perfect. Where you going? Just a little bit bigger. You have to push that air out and draw it up again. But no, your line is perfect. It does. That's why you're going to go home with all this stuff. Because I want you to start. I want you to practice just the process of handling these things. I think that some of it, when you go into a new environment, it's just overwhelming with opening and connecting and which step do I do in? Maybe you step home and just having this time on your own to do it. I think it's awesome. It's a different, gives you a different comfort level. Okay, if you've already gotten to 4, I'm going to go ahead and just tap. Don't leave it like that. Tap it. Okay, I'll work with you a little bit better. There you go. Perfect. Okay, everybody have a tap on their needle. Just go ahead and tap your needle, set everything down towards the top. Okay.
I forget I'm supposed to stay in one spot. Told you guys it was really bad today.
Okay, next thing we're talking about is reconstituting any sort of medication. So, did you guys see that in your chapter? About reconstituting. So, what does that mean? You have a powder. You have a vial that has powder in it. Okay? And you're going to use a diluent. D-I-L-U-E-N-T. Basically means a liquid. Okay? Usually it's like distilled water or something. Maybe normal stage. It's going to be mixed. The liquid is you're going to mix with the powder. Okay? So, the idea here is the same thing as what you just did drying up, except now there's an extra step. You need to clean that diluent, whatever that liquid is that you need to reconstitute it with. Clean the cap, draw out that liquid, okay? Also clean the cap of the powder, and then you're going to inject that liquid into the powder, okay? You're going to dispose of that needle if you need this, okay? Make sure it's covered. Once the liquid is in the powder, roll it. Don't shake it. Throw it back and forth, gently roll it, okay? So that it's mixed. The idea here is that it comes in a powder for a reason. It's usually not a very stable medication, so they only want to mix right before it's given. If you take it, it's going to have bubbles. It's going to foam. It's going to be really hard to draw out the right amount. Let's pull all kinds of foam, okay? So, keep mixing. Some of these, like Roceptin is one of them, it's an antibiotic that sometimes will be given intramuscularly. It's impossible to mix up. I'm just telling you, you will be getting here, just start walking with it, seriously, because it'll take a while to just mix all of it. That's why we did this powder. You're going to be tempted to do this and say, I can do this in 3 seconds. Don't do it. Keep mixing, okay? That's all you need to know about that. Except, once it's mixed, what do you need to do? Clean it off again. Okay? I would discard that old needle, put a new needle on to draw it up, and guess what? You guys discard that one too, because you're not going to inject the patient with that needle you just drew it up with. So it's just the same concept as what you just practiced, just an extra step of putting a liquid into a powder, mixing it, but then all the rest is the same. Okay? You're going to clean that top again, you're going to put the air in, you're going to flip it over, you're going to draw that amount up, put it down, take that off. these types of medications you're having to reconstitute are not usually ones that you should ever put in the fridge when you're done. That's something you're gonna draw it up, you're gonna reconstitute it, mix it up, draw it up, give it, okay?
Now, if we have an empty bottle of these, we do put that in the office hall thing too, right?
Sure, yes, all of the bottles should go in the shark.
Okay.
But do not put it in the shark until you document the lot and the expiration, okay? Because I can speak from experience, I've done that. And then it can be, oh shoot, what do I do now? I don't have it. Luckily enough, it was in a set of all kinds of vials, and they were all the same lot and expiration. So it works, but what I suggest you do is keep, if you're giving multiple things, keep all those vials in one spot, okay? Don't discard it until you come back out from the room. You need to document everything, and then throw them in the shark, yeah. Keep them in the lab or somewhere, okay? Somewhere away from any sort of patient interaction. All right, then we need to break. All right, let's break till 10:20, okay? And then we're gonna go over the rest of the injections, and by 11, we started to be used, okay? Anybody have any questions? Concerns? I don't like needles. I just like, you know what, I think you'll leave the class with a lot more confidence in us, because I think sometimes it's just exposure to something. Well, I was watching my son get all these shots and everything, and getting blood drawn and everything, and I thought, you know, people are like getting always 60%. Oh, I still remember, I mean, I have drawn blood and put IVs in and all kinds of things in the hospital. But then our middle daughter, she had Lyme disease when she was 15 months old. Oh gosh. She had so much blood drawn, and the phlebotomist was not capable of drawing her blood. It was the worst experience of my entire life, just watching. I mean, you literally felt helpless. Yeah. As your child, so it's like painful to watch. And you feel angry for the lady, but I felt empathy for her because I know how I would feel in that situation. It was awful kind of watch. I don't get preview, you know, but and she just lay there. She didn't fight it. She just lay there and watched it. They couldn't get it. They fish around. It was just awful. That's what I always tell them when I go to get blood drawn or anything. They have a tendency to stick so fishing. So it's like I can roll in veins. Please don't fish. If you can't get it the first fish, then don't follow. Here's somebody else. But I had like this baby when I was in the baby hospital. I had my first kid there. My arms were bruised. No, I had because of they. I was like. Then I had hair come in and said, what is that in your arm? So they're trying to get blood. This was ridiculous. So I'm straight up, that's awful.
I had nurse coaches got in her.
Yeah, that's not appropriate.
And blow out my veins. Oh God, she blowing. It'd be so.
Well, that's the thing, like it's so, like it's a hard situation, but our rule is always 2 sticks. If you can't get it, somebody else got to do it.
Yeah, that's what I thought. She did it 7 times, 5 a day. Oh my God.
Yeah.
Had to be to the hospital to get it done.
Yeah, no, they should have sent you before.
You're like when they start digging sick. And then they sit around and get a heater on one of my hand reader and end up from cellulitis from it. I was like, oh God.
Oh, yeah, that's it. You end up with an infection from something that's trying to.
Oh, then it has to be clean. Well, you take the needle from here over here to here, you have to move it around. Oh, you can't do that. You can't do your stuff.
Yeah, that's not appropriate.
I think my hardest part of watching my granddaughter get her first infection of influenza. She was 4. I mean, it just broke my heart. Her sugar was 1,448. I don't know how she did not go into a sugar coma. I'm so blessed. I'm so thankful to God. She's a miracle.
Yeah, that,
I had a great move from Fauquier to Fairfax, and by the time we got to college, because she was going up there, we live in Orange. We flew up there, and we got there for sure. We're still 800 something. She was great in the face.
yeah, that's very, very.
Yeah, she looked at me, she said, I'm okay, Mom, for with me, the airplane. And the helicopter, I'm like, oh, I just broke her. It was legitimacy. I think my first kid was my money's worth. They ain't no kid, they ain't gonna try to look that. They work for it.
Yeah.
They all got a bit of bacon.
Like 2 minutes. We have so much to do today. I feel bad. Gotta get you guys out of the right time. it doesn't work too. I mean, IPC was fine, but it's. Like, you see that line in there, I don't know if it's because the way they order it, sure, like, you know, they give you a variety of power. And I make it overpowered one. I don't know. Yeah, sure, like uses, this is the GT and Verizon cell tower.
They usually get more Verizon towers than they do.
Yeah.
There's supposed to be one up by the school on the hill.
Oh, yeah.
Yeah, they said there's the one there.
One was that, the one.
And he went down the further.
Yeah, I think that's one of our people working on it, right?
AT&T does.
Yeah.
But when I didn't have my AT&T job, which I was like, I tried it all, and she said, the first fee, $300 a month for a whole year, overcharged me, and would not refund it.
AT&T.
So,
We can get the internet out.
terrible. Internet service, and you can't get like Comcast or no, because they don't come down for work.
No.
So you gotta get, if you want certain internet or TV stuff, you gotta get Dish or Direct TV and all that.
You know, we go to the monthly service stuff.
Yeah.
Okay, if you guys want to go ahead and get out your insulin needles, please. Leave everything else there on your desk, because we will use this again. What we're going to try to do is start EKGs today. If we find it taking too long with injections, we'll start EKGs and then finish them out when we're here next time with phlebotomy, okay? Okay, so let's talk about intradermal. So, we're going to go through the skills list. And I want you guys to practice. We're going to try to practice on this. I know it sounds silly, but if you inject it the correct way in between the bubble wrap, you can actually get that little blood, that little bubble. Okay? So let's go over intradermal injection. What are we going to do first before we do any procedure? Okay. Also verify the patient. Okay, you're going to pull out this tuberculin that you're going to give to the patient, this little vial out of the fridge. What are you going to do when you look at the vial? Yep, make sure it's not expired. And you're going to hang on to it so that you can document the loss afterwards, okay? So, identify the patient. With the TPD type of thing, normally they'll give us patient handout. In some patients, they want you to explain this ahead of time. Most people understand they're there for an employment reason or for college or whatever it might be. They won't need a full outpatient education. Just be aware that some will. You will need to explain what you're going to do when they need to return, okay? Okay, so let's practice. I want you to go ahead and have your vial in front of you. And give you another alcohol. And I want you to draw up.
You want to take the other screw back in?
Not yet. No, just leave it out. Unless if you're completely out, then go ahead and put yours back. That's fine. But you're probably supposed to close this. I'm sorry. If you feel like you don't have enough, it's fine to inject it back in. Be careful the way you pull that out. Let's talk about needle format. I'm not trying to call you out. That's one way to see. When you uncap a needle, hold it horizontally, okay? Straight up. Uncap straight up so that you don't break. Because if the needle is long, you put it in there. Okay. Straight up, horizontally. Okay, so go ahead and draw up. Let's draw up 10 units. Make sure you never leave any unpacked sitting on the table, okay? All right, so go ahead and draw 10 units. Did everybody see that they need to take the orange cap off the bottom? Okay. 5 to 10 units, I'm going to go ahead and cap it. Because we're current. And we're at per state. So let's just hold it to the upright, hold it back all the way up. Yeah. Here. And you get my chair, bring that down. So it's something like tuberculin, if you're drawing it such a small amount, it's a tenth of a milliliter, you don't need to inject a tenth of a milliliter air. So a while, okay? You can, if you want to, do good practice, but not necessary. Okay, once you have your 10 units, we're going to pretend that are tenth of a milliliter. We're going to pretend that we swapped out the needle. So we've taken off the old one, we put on the new one, we're ready to go in the patient room, okay? So what do we need to do before we go to the patient room? Wash your hands. Yes, wash your hands. Before you start the procedure, you're going to put your gloves on, okay? So, you've got this in your hands, you're taking it in, talking to the patient, make sure it's Mr. Dory like you thought it was, make sure you said, hey, we're going to do your PCD test. If you have any questions, you have to know that you need to be able to come back within 48 to 72 hours. That's something good to tell them before you ever start, because guess what? A whole bunch of people will say, well, I work the next 4 days and I'm not coming. Don't even get it. Do not get it because it's literally a waste of their money. They're going to get charged for it if you place it. And then they're going to complain because they can't come back and they're going to have to pay for it. So, you need to come back and have it ready in 48 to 72 hours. If you have any questions, just go right to your form. Okay. Once you're ready to do the procedure, what should you do to the patient's forearm? Same exact alcohol prep. Okay, in the site, you want to start in the middle with any injection. Start in the middle and do circles. Okay? Friction, just like you when you wash your hands. Right in the middle and then circle back. Okay? So, when you're going to do the actual procedure, let me go grab an arm. He's a handful.
I'm just right after you rip it off.
No. I should say he's an armful, right? Okay, so when you're going, right here. When you're going in to do the procedure, you've already set the patient, gloves are on, everything's set up. Okay, gloves on, clean the site. I'm going to show you. If you guys can't see, you can stand up. I'm sorry, we don't have a very good setup here. So, circle, the new site, let it dry. None of this, okay? None of this, none of this, none of the blowing. Let it completely dry. Gloves are already on. To place the PCD, you need to pull the skin taut. P-A-U-T, taut. It's like pulling it tight, okay? That literally means with your thumb on your opposite hand, pull the skin so that it's tight. Okay? Right in the forearms, you're going to pull the skin tight. Next thing you want to check once you've taken the cap off is that your bevel is up. That means if you look closely, there is an opening in your needle. Okay? You want to be able to see that hole, and you want the point in the back pointed up. Okay? You're going to pull the skin taut, and you're going to barely insert it. What was the angle we were supposed to do?
45.
No, that's subcutaneous. 10 to 15. 10 to 15, which means almost completely flush, okay? So do you see, can everybody see the angle I'm at right now?
Yeah.
If you need to, stand up. So, right at this angle, you do not need to put the needle all the way in. I don't want you to put the needle until you can see no more needle. I want you to barely insert it, okay? Once it is in, it's up to you whether you hold it like this. However you want to do your hands is fine. I would keep holding the skin taut like this and just barely, do it very slowly, and you will see a bubble form. That is it. Okay? At this point, this goes in the chart. If there is a spot of blood, you can stab it. I'm talking barely touching it. This is not something that you rub in Give them a piece of bug. Make it fat. Make the instruction not to put any lotions or anything else on it. They want to leave it completely free. Okay? So, what I want you to do is take that little piece of bubble wrap, and I want you to practice. If you've already drawn it up, if you're at your 10 units, practice on your own. Say consultation group, all you need to do. Wash your hands, introduce yourself, make sure it's the correct patient, and then go through the process. Take that alcohol swab, clean that site, practice your finger placement. The non-dominant thumb below where you're going to inject. Practice your angle. Where the bubbles are at. So try to go in between the bubbles. I'm going to practice with you. Every piece of bubble wrap is different. But go in between the bubble wrap. You should be able to see a bubble form. Did you guys notice how slow the liquid goes into the syringe? You know why? Think about how large the gauge is. There's a really tiny gauge, very small opening. So when you're going to inject, make sure you check, bubble up, make sure you can see the opening. It's really hard to do this bubble wrap. Just practice the concept even if the bubble doesn't come off.
You want it in between the,
Yes, try to get in between the bubbles. It's really tricky. If you want to, in fact, practice injecting it into the bubble. Just remember your angle, 10 to 15 degrees, very low, not flush. Depth. So make sure you're practicing holding the needle out in front of you, okay? Don't turn it, don't angle it at all. Just put it maybe down the shoulder. Okay. This is another thing too that we can practice on the arms as you're taking home. Practice it on the arms on the bottom, okay? So you want that to be open. That bubble, you want that opening so that you can see it. You don't want to see it upside down. Yep. So I'm going to bring this around. I just want you to look at it. This is the type of card that you would be using. Some places will actually use a ruler type of thing. But this is the type of card that you would take in. These two actually, they get sent to patients to this facility until they let them read it on their own. But you can see down here as measurements. These are measurements in millimeters to see how large it is, okay? So, which is up to you. Yeah, yeah, exactly what we're doing. Yeah, so just usually, if it is a positive, you're not only will you be able to measure, but it'll be red. It'll be very visible. You can rub your finger over it. You'll have to finger, you'll be able to feel it during step, okay? This is the negative. Okay, once you feel like you practice, you feel comfortable with that one, go ahead and set that influence storage over to the side. My brother and college he was first Mason. It was many, many years ago. He was tested before he went to college as a freshman with his GPA, and it was negative. In his freshman year, he started developing a cough, a production cough. He was in a dorm room with somebody who was from Asia, and he ended up having another CCMA done because of his symptoms. And the CCMA was positive in the first test sector, and he actually had tuberculosis. So that's why there's so much right now about college entrances. They make sure they check that because you've got people coming from all different areas of the world. Kind of like right now with the pandemic, they're very careful about if you go on state or if you fly somewhere, they're double checking, once you enter back in. But this really do come back positive. It's kind of interesting. Okay, let's go to subcutaneous injection. So what I want you to do is pull out that paper that has this picture on it. It shows you the angle. We don't have the correct size needle for you to practice. So we're just going to practice with this syringe needle you already have attached. For these, we're going to go for subcutaneous and intramuscular. And for these, I want you guys to pull out, there's a little smiley face bouncy ball, squeeze ball in your yolk pen. We're going to pretend this is the patient, okay? You get to stab the happy.
Like we've never had that.
Yeah.
You cross in your mind.
I cannot remember to keep turning the camera. Somebody remind me if you can not doing it. Okay, so for subcutaneous injection, what is the angle? Okay, where should you give subcutaneous injection? Back. Okay, so inch and inch. Where can you pinch an inch? Arm, belly, not a belly button, but around the belly button. Side, okay? All right, so same concept as with the PCD. You're drawing up. We already practiced how to draw up into a vial. Clean the vial, check the vial, check water expiration. All of those same things are still going to happen. Right now, I just want you to practice the concept of giving the injection, okay? So, does everybody have liquid in their vial? Thank you. Go ahead and have at least a milliliter or so in your syringe. The syringe with the long needle. We're not going to use the insulin syringe anymore today. So that would go right into your pin. Get the needles off the table. So get about a milliliter. you have to think about severe allergies who have a reaction every time they get an injection. That's not something the candidate to be in like a family practice. So let's say they're stable with their allergy shot. This is what you guys are going to have to do. Usually there's separate refrigerators that will have a little bag with their name on it, and it will have all of their vials that they'll need. It is usually like a sliding scale. Look at last week. If they did well, increase it to this much this week. It's very clearly laid out, but always ask questions, okay? Usually you're giving more than one injection too. If so, ask the patient what they prefer, but a lot of times they'll do one on each arm, okay? If they want it on the same arm, separate them enough so that you're able to identify which site, which one was given, okay? So separate by at least an inch or two. If they have a reaction, you want to be able to identify which one they had a reaction in. Okay, so let's pretend we're going to patient room. What do we do? You already have your equipment. What do we do? Wash your hands. Gloves. Introduce yourself. Identify and make sure it's the correct patient. Okay. Ask questions. Do you have questions? Do you have concerns? Educate them if they need to be educated, okay? All right. So I want you to have your little yellow ball. What should you do first? Your gloves are on, hands are washed. What do you need to do if that's their skin? Clean it. Yes. Clean right in the middle of the site. We're going to pretend we're doing the upper outer arm, okay? Clean on the site, let it dry. Now, to practice this, it's a little different holding the squeeze ball, so you guys are going to focus more on the angle of giving it, so I'm going to show it to you here too, okay? To practice on its arms, what I would say is it doesn't matter if you squeeze above or below, but with your non-dominant hand, you're going to squeeze, okay? The idea here is you're squeezing to hold the spot. Once you insert the needle and start injecting, you want to let go so that it stays in the fatty tissue, okay? So, you squeeze, clean the site, squeeze, tap off. Squeeze the site, insert it, what angle? 45 at an angle. I would go up like this. You can also go down, doesn't matter as long as you're at a 45-degree angle. This is not the right size needle, so don't inject it all the way, okay? You're going to use a much smaller needle. Practice the angle. Once you have started injecting, you can't really let the squeeze ball go, but you would let the patient's arm go, okay? You pull it back out. And that's it, okay? For these types of patients, they sometimes may have a spot of blood because you have, opened their skin. Always have bug pads on hand if they need it, okay? You don't necessarily need a bandage. You don't really want them to cover a site, especially if it's an allergy shot, because you have to check it, okay? So just go ahead and practice. You clean the site, practice the angle. So hold the ball with your non-dominant hand. Part of this too is figuring out what you're more comfortable with, how you hold your hand. This is something that's good to practice at home. Don't even put the needle on at home. Just have the syringe and practice on somebody's arm. Like, how would I hold it? Am I more comfortable holding it above or below? It doesn't matter. Always be cautious, though, about needle sticks, okay? So if you hold it above, hold it kind of above where your needle is not going to hit you, okay? 45-degree angle. And it's kind of a mixed opinions about subcutaneous injections, especially in adults. But if you're doing injections, immunizations, if you're doing subcutaneous immunization in their leg, where they'll get them, if they're 5 and under usually. If they're large enough at 5, they'll just give them an arm. But the subcutaneous injection for kids, you should always draw back and check for blood, okay, before you inject anything. Because if it's supposed to go into the fatty tissue, you want to make sure you're in the fatty tissue. If you draw back and get blood, that means that you are in a vein. Okay? That's not right. You have to take it out, discard it, and start the whole process over. You don't want to go to the immunization to do it. Okay? So this is a good time to practice that too. Once you have inserted it, with that same hand, use your thumb and draw back just a tiny bit. show you what your arm. What was your question in it? What did that? You answered it. Okay. So if you're injecting, you can squeeze in the arm. Once it's in, if you're comfortable, you can pull back with the same hand. Or if you're more comfortable, hold the barrel with your non-dominant hand and then draw back. And then once you see there's no blood, push in. You don't need to draw back as hard as you can. You just barely pull back on the barrel, just to make sure that no red comes into your syringe, okay? If there's nothing, push it in. It's always best to give these immunizations and injections. You don't want to just squirt it in forcefully. Do it gently, okay? Obviously, if you're dealing with a small child who's getting an immunization, you don't want to like count 1 Mississippi, 2 Mississippi, because they're going to kick you in the face, okay? Do it gently, but be careful about it. Yeah. Questions? Just practice that angle, practice the drawback. Same thing as with the other procedures. Once you have finished, you have to document, okay? Document the gauge, document the site that you put it in. If you're giving a subcutaneous allergy injection, those patients have to stay in a waiting room for 20 minutes every single time you come, okay? Because you have to check for any sort of allergic reaction. So, if somebody were having an allergic reaction, if I get a medication that every office should have on hand. What is that? Epinephrine, yes, epi. Okay, like an EpiPen, epinephrine. Those are the patients that could possibly need an epinephrine. Even some immunizations, some people react very quickly. And if it's an anaphylactic situation where they can't breathe, they're saying their throat is tightened up. First thing you do is try to find help. Know where your epinephrine is always, so you can handle the situation. More than likely, somebody hired an RN or a practitioner or a doctor would be giving that, would be administering that. We're not teaching you how to give that. Just know what's needed in the event of somebody else for it, okay? Now, with allergy injections, you're going to be looking at their arms. So they wait for 20 minutes, but then they have to come back into an exam room because of privacy. You don't want to look at their arms in the waiting room with everybody around. And you're going to have them lift up their shirt, move their shirt, check it. So if there is a reaction, you need to be able to measure it. That's why you have a little measuring tape, and they'll have one somewhere in your lab. You actually measure the size of the reaction. Okay. So yep. Every injection, anytime you draw blood and you put an IV in, anything bevel is always up. You should see the whole facing you. Now practice giving it not to the left, like forward. So that you're going this way. But that's how you have to do it. Yes. This is your body. You want to be injecting forward. That's the other thing too. Anything that you're administering injection-wise. Position yourself how you're comfortable, okay? Obviously, they're closing the office. You can access where the site is. But make sure that you're comfortable with how you're positioned. Just like with blood pressure. You don't want to be positioned in a way that somebody's coming on you, okay? Same thing with an injection. Don't try to do it like this because the person won't do. Get yourself so that you're comfortable, okay? All right, let's go ahead and talk about intramuscular injection. What is the angle that we're giving an IM injection? 90. Okay, so 90 is straight up and down. You're giving it, they may know this site called for intramuscular injection. This is the deltoid, okay? There's a muscle right here. It looks like a triangle. You see a picture of your body. Deltoid. I want you to take your hand and feel, can you feel the bone right here? That is not where you give an injection, okay? You're not trying to hit a bone. 2 fingers. Go 2 fingers, feel that bone, and go 2 fingers below it. That's the honey hole. okay? That's your site where you want 2 fingers below where you feel that bone. That's the best way to check a patient, okay? You walk in, you're ready to give the injection, feel. Find your point where you need to be. Don't just eyeball it, okay? Feel that bone and know that you're going 2 fingers below that. After you've felt the site, what do you need to do? Clean it, okay? You don't want your dirty fingers, even if you have a glove on, touching them after you've cleaned. So you find that site first. You have a visual of it, see where you want to go, clean it, okay? So, iron injection, I want you to practice the same thing, except now rather than a 45-degree angle, it's going straight in 90 degrees. Iron injection, you absolutely have to draw back and check for blood. I can't tell you how many times I've had an iron injection and they've never drawn back and checked for blood. But you need to draw back, whether it's you use your thumb to pull the plunger or you hold it in the opposite hand and pull it. Draw back, check for blood, push it in slowly. Same thing for all these procedures. We're washing our hands, we're putting our gloves on, we're identifying the patient, we're checking, making sure it's the right medication, the lot, the expiration, leaving the site. Injection has to do with the angle. We're just changing the angle on this one. Drawing back. So most common sites are going to give us a deltoid. Other common sites, ventrogluteal is what they're going to call it, which is right in here. And I will show you in the lab to be able to find that spot, and I'll show you a video too. That's considered the butt injection, okay? For those patients, if you're handling an adult patient, best way to do it is to have them stand and where the table is that they were sitting on. You want them to lean over, pull their hands down to the side to be able to find that site, okay? It's important when you're doing an injection in that location to do it very slowly because those medications are really painful, okay? That's not something you want to pretty quickly. Obviously, draw back and check for blood. We'll put it in gently. There's also a way, if it needs to be a V-track method, which is one of the other things that's in the chapter. It's still an intramuscular injection. V-track means when you're holding that site, you're pulling your hand away, like you're pulling your skin away. The idea here is after you inject the medication, you're going to pull it out, and then you're going to let your hand go, and their skin goes back into place. So the idea is that medication cannot seep out of the muscle. Normally, it would be just like you give an arm injection, where you would hold the site, either above or below, inject, draw back, push it in. With the V-track, you're going to pull that hand to the side, okay, so that it's placed. Once you take that needle out, the skin, the muscle goes back in place. All right, go ahead and practice the 90-degree angle if you haven't already. Okay, go ahead and watch this for a minute. All right, just watch what she's doing since we don't get the lovely volume.
Giving these injections in the muscle because you want to avoid nerves and any gray vessels. So for the ventrogluteal, we are going to find our great trochanter. So we have her on our left side, so we're going to take our hand closest to the patient and we're going to put our palm on the great trochanter. So about right there. Then you're going to take your index finger and you're going to point it towards the anterior superior iliac spine, which is about right there. Then you're going to take your 3 fingers and put them together and keep your index finger straight. And you're going to form a little V. And in between that V is where we're going to go for our injection. So keep your hand like that. Take your alcohol prep and clean the site very well. Any germs in the circular motion for about 3 to 5 seconds. You're going to get your injection. I like to take my cap off in between my fingers, and you're going to go in at a 90-degree angle, okay? Of course, you aspirate because it is in the muscle. You want to make sure you're not in any vessels. You aspirate, and you have no blood. That's a good sign. And then you're going to inject. Hold it there just for a second to let all that get in there. And you're going to take out and engage your safety on your needle and just put a little gauze or Band-Aid over to prevent any bleeding. And that is how you give an injection in the ventrogluteal muscle. Next, be sure to check out my video on how to give an injection.
Okay.
Here, somebody's standing, you're gonna make an L along the bottom of here, okay? You use the rest of your fingers, you would pull your hand back, and right in between the V is where you're gonna hit. So we'll practice with hands in there so that you get the idea of the location. It doesn't matter if you have a needle like that, okay? I don't want to know you to back up. I do practice with how to find the site, not always have to do up. Once you clean the site, you can move your hand, okay? Move your hand, as long as you figure out your identifier, your location, move your hand clean the site. You will have to put your hand back there, though, to make sure you're still in the site. As long as you're not touching where things the alcohol, okay? So, other things about intramuscular injection. It is a longer needle, so you do need to put that needle in harder than you put a second finger. You're going in 90-degree angle. Does it need to go all the way to the tip where it attaches? No. Okay? Looks a good idea. Kind of dependent on your patient. Really, really frail person, you don't need to fix your entire ankle weight because you're going to go with that. Okay? So a large portion of the way in, but not all the way. Okay? If you're doing deltoid, which is the most common, inject, drop back. In other patients who will probably need to radiate from that. Okay? If you are going to break the muscle, that should be more. Questions, concerns? Everybody awake? We got a lot of sleepy eyes. All right, everybody stand up. Arms up to the side. All right, to the right. You got a hot today. You got a hot? Yeah. What? It's normally so cold. All right, touch toes. Oh. Wait, I have to sit down for that. All right, I need to sleep up. I make my kids do this at home when we're doing the virtual work. I'm like, everybody stand up. I'm trying to go to the class.
Getting ahead.
Okay, so we're going to go over EKGs. Does anybody have questions about injections? I want you to put all of that stuff, so your vial, your cap needle, and your skills kit, and the squeeze ball, in your skills kit. Injections are not something that you should practice on people at home, okay? If these are needles that have already been used, I don't want you to use
written them on a piece, on person, family member, only on the fall and bubble wrap. You can put your bubble wrap in there too. It'll come out of it. So like, this thing, like, in the video, don't go all the way in. We're going to say halfway and then halfway, yeah. It's on the side, but yeah, it's more than halfway. Yeah, the one is, you know, it's just, it's for adults, it's fine, but for kids, you're gonna have to be. So yeah, learning to read is important and it's more than halfway. Alright, so we're gonna talk about PKD. Any other questions about injections? Oh, actually, I have one more thing I want to tell you. If you have your phone or a laptop out, I want you to go to cdc.gov. CDC.gov, and I'll do it up here for those of you that don't have it up. All right, once you get to CDC, so look at the search bar and type in immunization schedule. Or immunization is fine. You see the first thing that comes up? Vaccines and immunizations. If your provider asks you to give a VIS sheet, vaccine information sheet, this is where you go. If you don't have a copy on hand. CDC.gov has all of the vaccine information you need. Okay? These are the sheets that you would print out. You can go down here and actually see the sheet. It's broken down. This website is awesome. It's completely awesome. When you're in healthcare, you need to figure out who needs what and when and what's the schedule. But the vaccine information sheets are here on this page. You can click on every single one and print them out. Here, vaccine information statement. So look at this. These are all considered routine vaccines. Look at all these. If you click on one of them, let's click on DTaP. Has anybody heard of DTaP if you have kids? That's a combination vaccine. So look how many things are in it. Diphtheria, tetanus, and pertussis. Sometimes they're called Pediarix, and it even has a fourth vaccine in it. So look right here. Print the VIS, or you can just click on it and look at it, okay? They even have it in other languages. My point is for you to see this. And here's an example of it here. We can't see it large. I don't want to take your time and download it. But here's the idea. If you have kids, you've been given these forms before. Most pediatricians' offices will give them to you every single time you get a vaccine. Because they want to say, yes, I gave them those papers. Yes, it's their responsibility to read it. Okay? That's what you can do is educate the patient. Give them the paper. Okay? This is going to explain what it's for, why they're having it, what kind of reactions are considered normal, and when to call a doctor. Okay. All right. Also on this page, on the CDC page, I'm sorry. I'm going to go all the way back to the main page. This right here, immunization schedule. This is something I knew absolutely nothing about, going from the hospital to family practice. If you're in an office setting and they expect you to give immunizations, they also expect you to educate yourself on when they're due, what's due when, and to understand how to read a schedule. So, part of it is just experience you'll get used to at what age they require which vaccines. This schedule says what is normal. This is what they should get at which age. But within this information too, it also explains, it'll say, so if you click on that, what you'll see is this. This little sheet shows, let's look at hepatitis B. So at birth, you need your first dose. Between 1 and 2 months, you need your second dose. Between 6 and 18 months, you need your third dose. Okay? It's going to do this for all the vaccines that kids should have. But within this same document, it will say, recommended catch-up immunization schedule, okay? It's the doctor's responsibility to figure out if they're due for immunization. It's your responsibility to double check because you're the one giving the immunization, okay? If you're unsure, this is awesome, okay? It's very worried, just look at it and it'll tell you, just let it see. Hepatitis C, minimum age for dose 1 and first. Dose 1 to dose 2 has to be at least 4 weeks in between. That's where you come in. If you look at their schedule, and they were just here 3 weeks ago, and it needs to be 4 weeks between doses, if you get that dose. Okay, that's your responsibility to check it though, okay? Because you're the one injecting it, alright? Just know that this is on the CDC site, okay? There's not going to be tests on this, it's just important for you to know if you're in the practice work to get to that, okay? Alright, now let's do EKG. So, look at that paper that's in front of you. We're not going to go over the deep details of the whys right now and which lead means what. What I'm concerned about you knowing for skills portion is how to place these. So look at your skills kit. You should have a little stickies on one sheet. So we're going to practice putting this on the manual, okay? If you find it, hold it up so other people know what it is. Everybody kind of? Well, good? Okay, so let's look at this sheet. And this is the machine that we're going to use a lot. So I want to look at the picture, the bottom right picture. This is how you're going to place the sleeve on a patient. Here's your machine. A lot of them are not this bulky anymore. It will actually be a set sleeve. And you can attach it right to a USB in your laptop. It's awesome. That's what we have. We never have these parts. So, things to know with placement EKG. Most physicals, once they reach their age, will require EKG. Educate patients, okay? Explain them what needs to happen. These people need to have close off of their chest, okay? So give them a gown, don't leave it open to the front so that you can easily access their chest, okay? If they have a lot of hair in their chest, you may have to take a razor and shave off those areas where the leaf needs to go. These sleeves, as sticky as they are, will not stick well to hair, and they shouldn't stick to hair because you're not actually going to be on the chest, okay? To get an accurate reading, you need to be on the skin. All right. My best suggestion to you guys is make sure this is all in sync with where every station is, okay? Because it is really awkward. Try to undo every single knot off of these things. Well, you have to be confident because you're already worried about the test you're going to run. Get the setup before you go in. Next thing, there, have them in a gown. Best thing you can do is give them as much privacy as possible, okay? These people are not going to feel very comfortable, especially the women with their chests completely exposed. So you want to do this as quickly as you can, okay? Quickly but efficiently. So, when placing them, let's look at the picture. V1. Let's look at all the V's first. So, V1, fourth intercostal, right side of the sternum. Sternum is here, midline. Right side. Think about your right side. So when you put it on a patient, it's going to be to your left, okay? So they are right. Fourth intercostal means feel your esophagus, collarbone. Down below that, you're going to start feeling, like we talked about, I think last week. You feel in between, you can feel your ribs, and the in between is called intercostal space. So all of these are going to go in between the ribs, okay? So you're going to count down 4 spaces, okay? Once you reach that 4th space, you're going to put a sticker there, okay? Where does these 2 go? 4th intercostal, left side. So directly across from each other, okay? V3. They may be 2 and 4. So, best way to handle number 3 is basically do number 4, okay? So, number below another rib, straight down. Follow this line is going to be down below the nipple usually, okay? If somebody has a large breast, you need to take your hand and lift their breast up and put it underneath. You cannot put it on top of their breast. There's too much fatty tissue. You will not get an accurate read, okay? To move somebody's breast, blood on, use the top part of your hand, okay? Please don't grab it. Use the other part of your hand, okay? We're trying to not expose the victim to comfortable, all right? So, we did 4. Now you can go back and do, we did 4. Now go back and put 3 on. 3 is going to be between 2 and 4. All right, 5, horizontal level, position 4 at left anterior axillary line. So, left side in front of armpit, okay? And then number 6, where does that one go? Position 4 at left mid-axillary. Here's that line. 1, 2, go there. 4th, intercostal space. You can wait on the 3rd one. You know the 4th one's going to go middle, below the nipple. That one. 3, 2, okay? 1, 2, 3, 4, 5, 6. You're literally going across the line, okay? So a lot of words. You want to understand where you're supposed to put them. So let me give you a hint. You need to know for testing purposes where this goes. But when you get into a situation, you're going to have something to help you. Whether it's on this, it's up here on the screen, you're going to have a way to help you. I want you to keep that picture so that you're comfortable with where they're supposed to lead themselves. You will have help once we get into the settings, but you need to know for testing purposes, and it's helpful to know in case your place does not have a little image of your field to look at. Okay? So, when you're putting this on, I highly recommend you use the arms and the legs first. Okay? So you're going to have D1 through what? D1 through 6. Keep those separate from left arm, left leg, right arm, right leg. Those important things to know with arms and legs is they need to be in a similar spot on both sides. So if you want to do right here on the arm, you can do right here on this arm. If you want to do right here on the leg, you can do right here on this leg. Okay? Keep them so that they're near each other. Alright? And they literally clip on. It looks like a little clip. And clip on to the bottom part of the sticky. Okay? Once they're all completely clipped on, you have to tell your patients to stop talking. Sometimes that's the hardest part. Some of these people cannot stop talking. They're just so happy to speak, but they want to be talking. They have questions or concerns. Some people get anxious talking more than they normally would. They cannot talk during the procedure. They have to be completely quiet, motionless. Okay? Normally it takes less than 30 seconds. So just let them know. I need you to be completely quiet or we're going to have to run it again. Okay? So you can cover up during the procedure. You can sit down back over during the procedure as long as these aren't sensitive. Okay? Other things to know. You're going to get a result usually immediately. That goes directly to the provider. You do not give information to the patient. The provider gives information to the patient. Okay? Any questions? Everybody's sleeping. All right, I need 2 of you. Once you guys come, we'll go live. Bring your stickers and come. So, you guys can be reading for the next chapter or within your section. It doesn't matter to me, okay? Now we're going to go to PKG, and that's it for this week. I'm waiting to hear back from Robert to get the grading rubric. If they don't have that rubric, I'll email to you guys for the final project. Yeah, so, did you hear about final project? Okay, did you hear about final? You did. Somebody? For the final project, it's up to you guys if you want to do it as a partner or if you want to do it separately. So probably give her to in 5 to 10 minutes conversation on any sort of healthcare topic. So anything with any of the chapter. 5 to 10 minutes, you guys have other tools. So PowerPoint, poster, something. If you do it with a partner, you have to split that 5 to 10 minutes with a partner. Okay? Good? Are you awake? Okay. All right, and I will print for you guys those other chapters in just a little bit. Come on, guys. Corey, can you still hear me okay?
Yes.
Yes. Okay. I brought you in the lab. We've got 2 people in here with us. I'm just going to show you what everything looks like on the mannequin, okay? So
Okay.
bear with me while I adjust everything. And you
That's
can
fine.
do that. I'll go grab the other one so that you can look up at the same time. Okay, so let's go ahead and one of you can come over with the with your stickers. Okay. Technology is not like my strong suit. It's been really interesting. I'm like, what's the camera? What's the laptop? Okay, let's try that. So whoever, do you want to go ahead? All right, and you want to close the door. We'll pretend like we're giving her privacy. And then what we want to make sure that you do with the patient is have them flat. Okay? You don't want them elevated at all. So we'll flatten your bed out. So, in normal situations, they're totally ready. Keep the gown. Keep them covered, okay? For our purposes. So, what I want you to do is find the spot first, and then we'll put the stickers on, okay? Hopefully the stickers come off of her. So, mid-clavicle. All right, so I want you to feel here. And now, we can't completely feel her ribs, so we're going to pretend like we're going down. Okay? So, first one is going to be on the 4th, in between the 4th. Okay, so we're going to count down. So you feel 1 here, 2, 3, 4. So go ahead and put a sticker here with the loose side down. The part that doesn't have sticky, yep, keep it. Flip it over, yep, and have it hanging down towards the foot. Right there. So, where do we put the next one? Directly across. Perfect. So, you want to make sure you're not putting it on the sternum at all. So, you got to go on either side of that bone. Right in here, directly across. Okay? And what you're going to do is put it a little bit higher. Okay. Now, let's go ahead and do 1, 2. We're going to skip 3 for a second, and we'll do 4. She's tricky because what we'd have to do is lift our hand up and move. So we're going to have to just go down a little bit and pretend like we're higher. So 1, 2, we'll skip 3. Go ahead and do 4. So mid-collarbone, directly down, close to her nipple, and we would go up and underneath. So you can just place it right here for now. Please do it on the nail. This way? Yep, that's fine. That's perfect. So now we need to go back and do 3. So you're going to put 3 in between these 2. So let's say this is right in here. We're going to put 3 about there. Maybe that's what we'll do. We'll pretend like she's a male and she doesn't have breasts. We'll put that right there. So 3 in between. So right in here. And straight down. You want to go the same direction. There you go. So 1, 2, 3, 4. So 5 is at anterior. So in front of the armpit, right along here. Pretending she doesn't have breasts, okay? And straight up and down again. Yeah, perfect. And what you can always do is come around to the other side, okay? You figure out what's more comfortable with the patient. And if you need to, come to the other side. And it also depends on how, your exam room, if the bed is up against the wall, it's a little trickier. You can always ask them to turn a little bit too. And then number 6. So So mid armpit. Right along the same line, so right in here. Up this way. Yep, perfect. Okay, now, other one. Right arm, right leg, left arm, left leg. So go ahead and pull those up. Yeah. And just, I would do one at a time. What's going to happen if you put them on your fingers, you're going to lose the stickiness with patience. They won't stick on our skin as well. I would do the same thing too. If I'm like scrapbooking, I like put them all on my fingers. Okay, so anywhere you want. Typically on a fattier area, okay? So I would choose right along the inner arm, not on the bone. Yep, perfect. So then go ahead and do the same exact spot on the other side. Yep. Now it's up to you. I always did inner down here, but you can inside. I suggest down above the ankles. If you want to go ahead and start on that mannequin, I'll come over and help you. I'm going to grab the other part. So what I want you to do is go ahead and grab. Sometimes the trickiest part is getting all this done. So go ahead and start separating them. Get these undone. And then you can start attaching just the arms and legs. Okay, so LA, left arm. Left leg. Arm A, right arm. Okay, so do this one first. Right back there.
breath and you could hear your name.
Yeah, no, that's okay. It's not if you understand the concept. You have to, so they would be a little bit higher than you. Have you looked at this before?
They actually changed the deal on how it works. So
That's great.
yeah.
Have you checked them?
Yeah, they have the statement and we do that, so we can actually go do that.
Yeah, yeah. Very good. Yeah, that's great. Just go ahead and connect up. Okay, so you got right leg, left leg, right arm, left arm, perfect. Okay, so go ahead and do these then. Do this thing, start with 1, go to 6. Okay. So go ahead and hold on to them and sign each one. So they just like numbers, they're all numbered down, right? Yep. So since we already put them in place, you just have to remember 1, 2, 3, 4, 5, 6. Just in order. It seems like such a big and scary thing, and once you do it a couple times, you realize as long as you have the stickers in the right place, it's just more time consuming than anything. How does your EKG machine work? Does it plug into a laptop?
We just have a laptop, yeah. All of, our leads are like this.
Yes.
We have a couple of the leads where there's a little tab, you flip the tab and it flips. Otherwise it's the same, just the laptop.
Okay. Yeah. Yeah, these are very old style machines. Right here.
When I first started, I had a patient who, I don't even know the word of it, but we had to do the EKG on the opposite side. Because like she told us whatever the word was that she was, and me and the other nurse had no clue what it was. So we went out after doctor. We were like, what does this mean? And so I remember she may have to look it up herself, but for some reason like her heart was like on that inside.
Wow.
So that was strange. That having to do it.
Yeah.
Like,
We're sorry.
yes.
That's okay. Only thing I would tell you is that when you're hooking it up in person, just make sure they don't touch. So we just put them a little too close here, which is fun. Good to know that. The other thing to know too, when taking these off, be careful. Because some people are really sensitive to their skin, and you can pick up through there. Just take them off gently. I would suggest pulling the skin down and then pulling it off. You're kind of pulling again. Okay. But yes, that's it. So then you would, with this machine, it's a little different. Normally we go to the pressure station and we actually do the EKG out of it. But, you know, thank you for it. So we turn it on. With this one, we just leave it through. If you have it, you're the type of same location, she can give you better information on how it will use system. But if you plug it into your USB, you will obviously patient's information. Likely you can go in the tree, you can go to the top and the charts or information are in there.
Yes.
Okay.
Yeah, you'll be able to look at patient up on the EKG laptop. You'll be able to look at and you know,
So you don't have to verify
unless they're moving.
Right. Okay. So the information will be in there once it's ready to run. With this machine, we would just hit auto and put it on out. We can give the payment to the provider. Most studies now said, we have everything hooked up. I'm totally okay. Any questions? Sure. We do on Thursday. Hold on to those practice systems. Would you tell them to take the things off themselves? No, I would take them off. Yeah, I would take them off. Just be very cautious about how you pull them off. But no, I had a few men who wanted to take them off themselves, but no, usually my dad did. Yeah, yeah. It's I'm not too concerned about who pulls them off, especially like elderly. That's when I'm really it's so thin, so fragile. You want to pull it off, so you can be careful because if they rip it off, they're at risk of a skin tear. You don't want them to have a problem because of the procedure. So yeah, no, this looks great. Just go ahead and unclick everything. What I always do is take off all the leaves, arms, legs, chest, put that to the side, and then get all the stickers off. I think tangled. Oh yeah, that's what I was saying. Make sure it's untangled so this before you go in the room because it's a little awkward when you're like, yeah, trying to undo knots and pull it apart. Laura? Laura, are you there?